Good evening. Can you hear me?
Yes, ma'am.
Yeah, am I clear? Okay. So
Yes, ma'am.
today another topic in virology we'll be discussing. Okay. So it is known as herpes viruses. Actually, you would have read it before the hepatitis virus, isn't it? And it's a very common set of viral infections that we come across all over the world. And today we are going to see about two types of herpes viruses, and the remaining we will see later. Okay. So saying, I will go on to the introduction to herpes viruses. So they are all DNA viruses. Okay, the herpes viruses are DNA viruses, and they have the ability to establish latent infections. Latent means, you know, right? The virus enters into the body, and then it doesn't immediately cause any signs and symptoms of any disease, but then it remains within the human body for a long time. Whenever our immunity is compromised as a result of, you know, some stress or some other infection, at that time suddenly it will cross the infection. In fact, the word herpes comes from the Latin word herpine, Herpein, which means to creep. That means it comes very slowly. There are more than 100 known viruses among this herpes virus family itself. So more than 100 types of herpes viruses are there, but only a few of these herpes viruses cause the human infections. Okay, and so let us see about which are the different herpes viruses that cause the infections. Okay, so first one is, before going on to the four important herpes viruses which I'm going to discuss in these two classes, just let us see the introduction or the morphology of the herpes viruses in common. That is, all the herpes viruses are enveloped viruses. And you know, usually the envelope is made up of some lipid, isn't it? And this lipid is derived from the host cell nuclear membrane. And why nuclear membrane is that? Because all the DNA viruses, they replicate in the nucleus. The RNA viruses replicate in the cytoplasm. So when the virus has finished its replication and it's going to come out of the cell, it has to bud through the cell. So in this case, because it is multiplying in the nucleus, it has to bud through the host cell nuclear membrane. So the lipid component is derived from the nuclear membrane, but on the surface of it, you will be having these spikes. No, they all will be containing the antigens of the virus. So only the membrane is got from the host. These spikes are all part of the virus, and they are antigenic. Each one of these spikes is about 8 nanometers in length. So this is just a diagrammatic representation of the herpes virus. And another important thing is that inside it, it has the capsid. So you have the virus envelope, and on the surface of the envelope, you have the spikes, and inside it, you have the capsid. And you can see one geometric figure there. So this shape is known as an icosahedron. This is known as an icosahedral capsid, and it has got 162 capsomeres. An icosahedron is a polygon which has got 20 faces, okay, or 20 sides, 20 faces or surfaces it has got, okay. And between the envelope and the capsid, you have an amorphous material called as the tegument, which also contains the viral proteins. So this is the envelope, and this is the capsid, and this is only known as the tegument, and all the viral proteins are present in it. So this is the capsid. The capsid is in icosahedral symmetry. Outside is the envelope, which contains the glycoprotein spikes. Okay, and inside it, between these two, is the tegument. This is the area where the tegument is present. And once you go inside the icosahedral capsid, that is the core, you will have the DNA. I told you it's a DNA virus, isn't it? So it's a linear, that means long, okay, like a straight line, double-stranded DNA genome. So that is the structure of this virus. And with the envelope, the diameter will be around 200 nanometers. And without the envelope, the diameter is 100 nanometers. Another important part of this virus is that they replicate in the nucleus. I already told you, they replicate in the nucleus of the host cell, and they form Cowdery type A intranuclear inclusion bodies. So this is an example for an intranuclear inclusion bodies. It's known as Cowdery type A. Okay, another name is Lipschutz inclusion bodies. This is typical of all the herpes viruses. Okay. And now coming on to the family of herpes viruses, based on the replication and the diseases where they're caused, we have three main subfamilies. So the first one is known as the alpha herpes virus. Then you have the beta herpes virus and the gamma herpes virus. Among these three, the alpha herpes virus only has got a very short replicative cycle. So within 12 to 18 hours, it can replicate. Okay. And it has a variable host range, can affect man as well as some animals. And an important part of this virus is that, important feature is that it causes latent infections in the sensory ganglia. Okay, the sensory ganglia of our body, this virus will go and sit. And whenever we are under some stress or whenever we are getting fever or anything, this virus will become activated, and then at that time it will flare up and cause its infection. Example of alpha herpes virus only is herpes simplex virus and varicella zoster virus, which causes chickenpox. Herpes simplex virus causes herpes simplex. So the first type is alpha herpes virus. Then the second type is beta herpes virus. The type virus for this group is Cytomegalovirus or CMV. These viruses replicate slowly as when compared to the alpha herpes viruses. And compared to this we told no, it has got a variable and a wide host range, whereas this one has got only a narrow host range. And then it has an affinity to go and affect the fibroblasts. Okay. And one more important character is these viruses, whichever cell they are infecting, they will cause the enlargement of the infected cells. So that is known as cytomegalia. So that is why the name cytomegalovirus. Okay. And they also like to cause a latent infection in the salivary glands. Okay. Just like how the first one, the alpha herpes virus, causes latent infections in the sensory ganglia, this one will sit in the salivary glands. Okay. Then the third group is the gamma herpes viridae or the gamma herpes virus. This also has got a narrow host range, and this one, however, has got affinity for the lymphoblastoid cells. Okay, T cells, B cells, and it causes a latent infection in the lymphoid tissue. Example is the Epstein-Barr virus. So these are the three subcategories or subfamilies. Alpha herpes virus, where the type virus is HSV and VZV. Beta herpes virus, where you have cytomegalovirus, and the gamma herpes virus is the Epstein-Barr virus. Alpha, they cause latent infection in sensory ganglia. Beta is in the salivary glands, and gamma is in the lymphoid tissue. So till now what we have seen is, we have seen the morphology of the herpes viruses in general. Okay, that is the family of herpes viruses. We have seen that they are enveloped, they are DNA viruses, and they cause latent infections. Okay. And this lipid envelope is got from the nuclear membrane of the host, has got surface spikes, and then inside you have the capsid in icosahedral symmetry, and inside it you have the double-stranded DNA. It is linear, so like a line. And between the capsid as well as this envelope, you have the tegument, which is rich in viral proteins. Then we also saw that it's multiplying in the nucleus, and then it causes intranuclear inclusion bodies known as Cowdery type A inclusion bodies. Then we went on to see that there are three subfamilies, alpha, beta, and gamma. And we saw where it's lying latent. Alpha in the sensory ganglia, beta in the salivary gland, and gamma in the lymphoid tissue. And we also saw the type viruses. Okay, so in alpha, we have the herpes simplex virus and varicella zoster virus. In beta, we have the cytomegalovirus, and in the gamma, we have the Epstein-Barr virus. Now, the subtypes of herpes virus, another type of classification, if you see, I told you that more than 100 types of herpes viruses are there, but only a few of them cause infections in human beings. So among those which cause infections in human beings, 8 important subfamilies, 8 important viruses have been identified, and they're given the name as human herpes virus, HHV, HHV 1 to 8. Okay, so human herpes virus 1 is also known as herpes simplex type 1. Herpes virus 2 is herpes simplex type 2. HHV 3 is varicella zoster. 4 is Epstein-Barr virus. 5 is cytomegalovirus. 6 and 7 only cause exanthum subitum and roseola infantum. Okay, and HHV 8 causes Kaposi's sarcoma, and so it's known as Kaposi sarcoma associated virus. Okay, so these are the subtypes of the herpes viruses. So important human herpes viruses are type 1 to 8. Out of these 1 to 5 we will be seeing in detail in 2 lectures. Okay, so today the first virus among these herpes virus family we are going to see is herpes simplex virus. Okay, so till now we saw the family of herpes viruses. Okay? And among these herpes viruses, one of the types are herpes simplex virus. Don't mix up herpes virus with herpes simplex virus. Okay? Herpes virus is the name of the family. And inside that you have different types of viruses. One of them is the herpes simplex virus. It is short form is HSV. Okay. And this virus causes natural infection only in human beings. And in animals, it doesn't cause infection. But however, in the lab, we can produce infection in the lab animals by inducing or inoculating them with the virus. And then this herpes simplex virus, HSV, 2 types are there, type 1 and 2. So HSV type 1 is usually transmitted by contact, okay, and it produces lesions around the mouth. So, and HSV type 2 is usually causing genital tract infections and it is transmitted venereally, okay. So type 1 is usually contact, direct contact or droplet infection, whereas type 2 causes genital tract infections and it is transmitted venereally, okay. Karthik, can you please erase what you have written here? It will be nice if you can do that. Thank you. So this is again the structure of the virus, the herpes simplex virus. Okay, so you are seeing again, this is structure of the herpes simplex virus. First, what picture I showed you is just herpes virus in general. Okay, so you have the envelope proteins, then you have the lipid envelope, then you have the tegument here you see, and then you have the nucleocapsid in icosahedral symmetry, and then you have the double-stranded DNA. So I hope it's clear again. Okay, and then coming to the infections caused by herpes simplex virus, you know it's a very common infection. And if you check for herpes simplex antibodies in adults, you will see that 60 to 90% of the adults will be showing antibodies. Okay. And the source of infection, you know, either it will be another case or asymptomatic carrier. And transmission for HSV1, it's usually close contact. And for HSV2, it is venereal. The virus enters through defects in the skin or in the mucosa. Okay. So that is if you have any small ulcer or cut in the skin, the virus can also enter like that. Okay. And once it enters through the skin or mucosa, in mucosa, you know, something like an abrasion. So once it enters, gets its entry, it will multiply inside the cell. And then from one cell to another, it will spread. And then its final target is the nervous tissue, isn't it? So it enters the cutaneous nerve fibers. And inside the axon, intra-axonally, it is transmitted to the sensory ganglia. And then it replicates inside the ganglia. Okay? And then centrifugal migration. That means away from the center. Again, from the ganglia, it comes back to the skin and mucosa and it causes the lesions. Okay? And the virus can remain latent in ganglia for a long time and can get periodically reactivated. So this is known as trigeminal and sacral ganglia. It can be, these are very common places where this virus can remain latent. So it enters through defects in the skin and mucosa, multiplies locally where it has entered. Then from one cell to another, it will spread, goes to the cutaneous nerve fibers, and it is transported intra-axonally. So within the neuron, it is going to be transported right up to the ganglia, where it replicates, it migrates centrifugally, and then goes to the lesions, cause the lesions in the skin and mucosa. Okay, so that is the thing. And this picture I have put just to emphasize that all the herpes viruses are going to multiply in the host cell nucleus. Okay. Then coming on to the actual herpes simplex, the disease. The typical lesions will be like this. Okay, they're thin-walled lesions. They're umbilicated. That means having a central depression. and having a thin wall over the roof of this lesion. After some time, this roof breaks down and then it forms tiny superficial ulcers, and these heal without scarring. And primary infections are widespread, meaning when you're getting the infection for the first time, you'll be getting it all throughout the body. And then, but however, it becomes latent in one particular ganglia. So recurrent infections are usually localized. And any viral infection, it needs cell-mediated immunity to get cleared, isn't it? And in HIV infected individuals, the cell-mediated immunity is a little compromised. So all these viral infections become very severe in HIV infected individuals. So you saw what is the type of lesion here. Okay, so it is thin walled umbilicated lesions. Then it gets ulcerated when the roof breaks down. And then these ulcers later on heal. There's usually no scarring except for when there is a bacterial secondary infection. And primary infections are widespread. Recurrent infections are localized. Okay, so this is about herpes simplex. And these are all the places where you can get the infection, the sites. So herpes simplex virus 1 means you can get encephalitis. That is only the most dangerous disease. There can be conjunctivitis. The oral cavity can get affected. The pharynx, esophagus, okay. Then it can be on the chest, you can get lesions, tracheobronchitis, you can have pneumonia, herpetic whitlow, this we'll discuss, okay. Similarly, herpes simplex 2 also can cause meningitis, again oral cavity lesions, and then it's a sexually transmitted disease, isn't it? So it can cause genital herpes and perianal herpes. So this is important. And any herpes infections, most of them, it's common in children between 2 to 5 years of age, and they get 1 to 3 days after exposure. Majority of the infections are asymptomatic or inapparent. You will not even notice that they have got the infection. But again, how disease is severe or not depends upon the site of the infection, the age of the person, the immune status, and the type of the virus that is affecting. All these factors you would have noticed for coronavirus also. Okay. And then the herpes simplex virus, where all it can cause infection. So in the skin, so cutaneous, different mucosal areas, ophthalmic in the eye, CNS can get affected, the different viscera can get affected, genital, and then you have the congenital herpes. So coming to the first one, that is cutaneous herpes, the commonest site is the face. So either on the cheek, the chin, or around the mouth, or on the forehead. Any one particular area can show these rashes, that picture which I showed you earlier. In the case of infants, it will form the rashes in the area where the diaper is worn. So it looks very much like a napkin rash. You can get confused for a napkin rash. Then fever blister, this is what I meant. See, whenever you are studying for an exam, sometimes you would have seen that some people get ulcers around the mouth, or when somebody has fever, they get ulcers around the mouth. That is nothing but this by herpes febrilis or labialis. The virus getting reactivated at a time when you are under stress. Okay, that is also known as fever blister or herpes febrilis. See, all these are important MCQs for you. Okay, then what is this herpetic whitlow? I told you I'll discuss. So this is an occupational disease. So doctors, nurses, by mistake, they touch the patients with these lesions. They can develop the same kind of very painful, a crop of these painful lesions on the index finger, and that is known as herpetic whitlow. Then you have eczema herpeticum. It's a herpes infection in children with eczema, where crops of vesicles in the affected area and they get ulcerated. Okay, and that means a person is already having eczema, and this will go and infect the skin which is having eczema. So in the area you will have crops of these vesicles, and then you have severe ulceration. Okay, and this one more thing this herpes virus will do is it causes a skin condition which is very similar to that caused by vaccinia virus. So that is known as Kaposi's varicilliform eruption. Okay, so this is about this herpetic whitlow. So what are all the skin lesions? You have the common sites we saw where these lesions can occur, and then variations are napkin rash like lesion, herpes febrilis or fever blister. We saw herpetic whitlow. We saw eczema herpeticum. And then what this similar to this vaccinia virus infection known as Kaposi's varicilliform eruption. So coming on to the mucosal herpes, in mucosal herpes, the buccal mucosa is very commonly affected. So you see here the lesions in the oral cavity, Can cause gingivo. Gingivo means gum, and stomatitis means oral cavity. Pharynx means you have the backside of your throat, the nasopharynx and the oropharynx. So gingivostomatitis and pharyngitis, so it can be very painful, and you'll have these vesicles occurring all over these areas. And from this gingivostomatitis, you can also get a secondary herpes labialis, that is the lips also will get affected. These vesicles get infected, means they become more painful. Okay. Then the third one is ophthalmic. This you will learn in your ophthal postings. It can cause acute keratoconjunctivitis. So the cornea as well as the conjunctiva, it can be primary or secondary. Okay. And it causes a follicular. In the conjunctiva, it can cause follicular conjunctivitis with vesicle formation. Small vesicles can form on the lid. So you can imagine how irritant it will be. Second thing is in the cornea, very typical of this herpes simplex infection is this dendritic ulcers. Okay, this they will ask you in your MCQs, and you will see many of these cases when you go for your ophthal postings. Dendritic ulcer, when you see that itself, this branching dendritic ulcer in the cornea, you have to suspect herpes simplex keratitis. Okay, and it's a very common cause of corneal. So it can cause conjunctivitis, keratoconjunctivitis. It can also cause chorioretinitis. So the cornea can get affected, facing retinitis. So these are the common ophthalmic conditions. Now coming to the CNS, one condition is encephalitis. This is very dangerous condition. You know, the child, either that you will lose the child, very common in children. Okay, and it's a very severe infection. Either the child may die or may be surviving with some focal neurological deficit. Another CNS lesion it can cause is meningitis, or it can cause a Guillain-Barré syndrome or sacral autonomic dysfunction. Other types of visceral herpes is HSV can cause esophagitis. So esophagus affected means no, you'll have difficulty in swallowing, and then you can experience the weight loss, and then there is the pain in the substernal area. And respiratory tract means it can cause tracheobronchitis and pneumonia. In the skin, it can cause erythema multiforme. Okay, and disseminated herpes simplex infection can occur in immunocompromised individuals, like I told you, HIV patients, and in people with malnutrition, because you know that you need proteins only to make all your immune cells, your antibodies and all that. So when you are malnourished, your immunity also takes a beating. So these are the different forms of visceral herpes. Now we go to the next type known as genital herpes. So this is usually caused by HSV2. It's a venereal disease. So you can see ulcers, okay, vesicles leading to ulcers. So vesiculo-ulcerative lesions, which can be very painful. And in the males, it is there in the penis and urethra. The females, it can be there in the cervix, vagina, vulva, and in the perineal region, as you can see here. And the cervical infection alone, if they have it, it may be asymptomatic, and it may cause, spread to the sexual partner without the person being aware of it. Because usually only when the cervix is affected, there will not be any signs and symptoms. And you know that some kind of association has been studied between herpes simplex virus type 2 and carcinoma cervix. So now coming on to another important manifestation of herpes simplex virus is congenital. You saw torch infections, isn't it? TORCH. In that T stands for toxoplasma, O stands for others, R stands for rubella, C stands for CMV, and H stands for your herpes simplex. So it's a very important virus causing congenital infections. A transplacental infection can occur with both 1 and 2, okay, type 1 as well as 2. It can lead to congenital malformations. So usually during birth, if the baby gets the infection, it may be due to HSV2 because it may be present in the genital tract of the mother. Postnatal, after birth, suppose it's getting infection, it can be from the mother who's having HSV infection elsewhere in the body. Okay, and neonatal herpes can cause either lesions localized to the eyes, mouth, or skin. Okay, or it can cause disseminated herpes leading to multi-organ involvement, encephalitis, leading to a high mortality. So either it can be localized or it can be disseminated. It can be multi-organ involvement, encephalitis. In those cases, it may lead to death of the infant. So now coming to the lab diagnosis of herpes simplex, remember these headings, okay, for all virology. you will have to discuss under these headings. So microscopy, okay, just like how you use gram stain for uh, bacteriology, here we cannot do gram stain. So we'll see what we can do with microscopy. Then antigen detection, trying to detect the viral proteins, trying to isolate the virus, then doing a viral serology. That is, you're looking for the patient's immune response to this virus, and then molecular methods like PCR. Okay. So first technique is microscopy. First technique that you'll be doing is a Zank smear. So T is silent. So Zank smear is nothing but what you do is you take a smear from the base of the lesion. So you have these vesicles, isn't it, in the skin. So make a smear from the base of the lesion and you stain it with this dye, aqueous toluidine blue O. Okay, 1% of this dye. You leave it for 15 seconds and then you can examine it under the microscope. Okay, you'll be seeing these kind of cells. These are known as the Zank cells. These are nothing but multinucleate giant cells. That means the affected cells of this virus are all fused. Okay, so they form multinucleate giant cells. The nuclei are all packed together. So they're known as faceted nuclei. And then they have this homogeneously stained ground glass chromatin. Okay, ground glass chromatin appearance. So these are the Zank cells. Okay, then if you do a GKMC staining of this smear, you can see the intranuclear inclusion bodies known as the Cowdery type A intranuclear inclusion bodies. Another type of microscopy you can do is you can do a direct electron microscopy and try to observe the virus in the clinical sample, but you know that electron microscopy is very expensive, so it may not be possible to carry it out in all the centers. So under microscopy, we have described Zank smear, GKMC stained smear, and then electron microscope. Okay, in Zank smear, you will see the Zank cells. In GKMC stained smear, you will see the intranuclear inclusion body, Cowdery type A, and electron microscopy you can see. Okay, the next test is antigen detection. You can detect it, see the same smear from the lesion you have taken, isn't it? So what you can do is you can stain it with fluorescent antibody test. Okay, and then look for fluorescence. So suppose the antibody, suppose the antigen, that is the herpes virus antigen, is there in the sample, it will be there in the smear. So when this fluorescent labeled antibody goes and reacts with the antigen in the smear, it will get attached to it. So it will emit fluorescence when you examine it under the fluorescent microscope. DNA detection by PCR, you know that PCR is a technique which will amplify the DNA. We can have a discussion on this little later, elaborate discussion on PCR and real-time PCR also. And virus isolation is another technique, but you know that it is not like bacterial culture. Viral culture, you need to have special cell lines because virus is a obligate intracellular pathogen. So you need to have special cell lines. So you can take the vesicle fluid, no? The fluid from the vesicles or the CSF or saliva or swabs from any of the lesions and try to inoculate it in any one of these cell lines. So human embryonic kidney, human amnion, don't forget, that is only very common for all the herpes viruses. Human amnion, rabbit kidney cells, diploid human lung cells, okay, chorioallantoic membrane. So you can try to isolate the virus from any one of these structures, okay, and you will look for cytopathic effects. So the cytopathic effects usually develop in 24 to 48 hours. So I told you, no, type A viruses are fast replicating viruses. So the the cytopathic effects will develop very fast. So what is the cytopathic effect? See, you can see here, the cells all start fusing with each other. So that is the cytopathic effect. So you'll get heaped up cells because they've all joined together and they form a syncytium or a giant cell. Cells are heaped up. So here they'll all at first stick to each other and then they fuse. So you get one big giant cell being formed. Okay. And on the chorioallantoic membrane, it will be forming pox. Okay, just like small, white, shiny, non-necrotic pox. Okay. And the serology test is, you can see the antibodies will develop in a few days. So you can try to look for IgM antibodies to this herpes simplex virus. But this antibody detection is usually useful only for primary infection because once you get the infection, you're going to be always positive. So secondary infection and all, it will be difficult to find out whether it is the second time you are getting infected or the third time you are getting infected. So just checking the lab diagnosis again, revising, you will see microscopy. So in microscopy, you can do electron microscopy, gene sustain microscopy, Zank smear. Okay, don't forget Zank smear. Don't forget Cowdery type A intranuclear inclusion bodies, which is typical of all the herpes viruses. Okay. Antigen detection, I told you, try to do it by fluorescent antibody technique. DNA detection, we do PCR. We can do conventional or real-time PCR. Virus isolation, remember at least two or three of the cell lines. So either human embryonic kidney or human amnion. Okay. Use the vesicle fluid, the spinal fluid, or the saliva or the swabs. And then what is the cytopathic effect? You will get foci, that means collection of cells will be there. They're nothing but they're heaped up cells and with syncytial or giant cell formation. Okay. And then serology, I told you, trying to look for antibodies. You look for IgM and IgG. And I told you only for primary infection it is useful, because if you're going to keep on getting reinfected, your antibodies are always going to be positive. So you don't know which time it is herpes, which time it is some other viral infection. Okay. So that is about the herpes simplex virus. Was it clear? Today I want to just discuss one more this is a smaller virus. And before going on to the next virus, I would like to tell you that herpes simplex is again a very important essay question for you. And you will also come across many of these herpes simplex cases, virus case infection in your private practice or your government practice in your hospitals and all that. Okay, so you should know to identify the lesions. And always, when a child with encephalitis, you should know that you should think about herpes simplex encephalitis. And then also try to remember all the congenital herpes. Okay, congenital herpes, and remember the torch infections as a whole. And the different sites where you can get the herpes viral infections. Also, remember that it belongs to the herpes virus family. In that, alpha herpes virus only is herpes simplex virus. And two types are there, isn't it? Herpes simplex virus, type 1 and type 2. Type 1 causes lesions above the waist and type 2 below the waist. And type 2, they say it is sexually transmitted. Type 1 is direct contact. Okay, then we saw the sites where it is getting affected. Then we saw the lab diagnosis of the herpes simplex viral infection. So now we will go on to the next virus known as cytomegalovirus. So the same thing, you can see the enveloped virus, and inside it you'll be seeing the viral envelope. Then inside you are seeing this icosahedron, isn't it? The capsid in icosahedral symmetry, and inside it you're seeing the DNA, which is double stranded. So this is known as cytomegalovirus. It causes enlargement of the cells that it is infecting. So that is why it is known, that term is known as cytomegalia. And one more thing it causes is, it causes prominent intranuclear inclusions which look like an owl-eye appearance, okay, of the intranuclear inclusion bodies. So two things, cell gets enlarged, and second thing is this prominent intranuclear inclusions. Okay, that those two things you should remember for this virus. And another name for it was salivary gland virus. I told you, it was lying latent in the salivary gland. And you have both human as well as animal viruses in cytomegalovirus. Unlike herpes, where you saw mainly herpes simplex, where you saw mainly human infected virus. And one more point about this virus is that, see, it causes very mild infections in adolescents, adults, and all that. But it causes very severe infections in neonates and in immunocompromised people. Okay, and it can also cause intrauterine or postnatal infections in children. So this cytomegalovirus also causes congenital infections, and this congenital cytomegalovirus infection only is a very scary thing. We'll see about it a little later. So among all the herpes viruses that we saw, this is the largest member. So size is biggest. Okay, so it may be around up to 200 nanometer in diameter. And it's very specific. That is, human cytomegalovirus will affect only humans, and animals will affect only animals. Okay, it will not affect the cross-infect, like human strain affecting animals, and the vice versa. And I told the cytomegalovirus likes this fibroblast cells. Okay, so it grows in human fibroblast cell culture, but it is a very slow growing virus. So the cytopathic effect take about 50 days to appear. So, it's not possible to wait for 50 days to come to a diagnosis. Okay. Then how does it spread? So again, close contacts, salivary or through other secretions or sexual contact also it can spread. It can also spread by blood transfusion, organ transplantation, okay? And it's very highly infectious to the infant and can cause a lot of damage in the infant, okay? So many of us, again, like the herpes simplex, we can get infected with the virus, but the disease is very rare. So very rarely you produce the manifestations of the disease. And again, this is also same thing for all herpes viruses, prolonged latent infections with occasional reactivation. Okay. And clinical disease, which is important that you have to see, is intrauterine infection and the postnatal infection. So when the mother gets the infection, and then when if the pregnant mother gets infected with cytomegalovirus and she passes on the infection to the baby, the intrauterine infections can lead to following thing. One, the baby can die within the uterus itself. So that is fetal death. Or very rarely the baby can survive and be born with the disease known as cytomegalic inclusion disease of the newborn. And this can be really fatal. So at that time itself, the baby can again die after being born, or maybe born with all these problems like hepatosplenomegaly, jaundice can be there, thrombocytopenic purpura, and hemolytic anemia. Okay, the cytomegalic inclusion disease, I told you, no, the CID causes microcephaly. So this is one of the causes of microcephaly. It can also cause chorioretinitis. So this is a triad. Okay, cytomegalovirus congenital infection is microcephaly, chorioretinitis. So eye is affected, brain is affected, and you can get this cerebral calcification. So this is very typical of two infections. So one is the cerebral calcification, very typical of congenital CMV infection and congenital toxoplasmosis. Keep it in mind. This will come as an MCQ for you. And this, because there is microcephaly, you know that those who survive this crisis can develop mental retardation. So the babies which are born and which survive with all these complications can go on for mental retardation. Okay, so that is a sad part of this infection. And but when you take older children and adults, nothing, they just are asymptomatic. Some people who get the infection following a transfusion, very mild post-transfusion mononucleosis, that is a mild low-grade fever, body pain, and then they become all right. But however, somebody who is immunocompromised, this CMV can go and affect them and even can cause fatal infections. So similarly, when a person is having HIV, person when is having some malignancy, the immune system is already weakened. Okay, and then the CMV will go and further attach to them, and then it will cause the problems. Regarding the lab diagnosis, so what are the different things? One is in microscopy, you can see the cytomegalic cells. I told you, no, the enlarged cells. This is only a picture of the owl eye appearance. Okay, this is an inclusion, intranuclear inclusion body, which is produced by cytomegalovirus. So these cytomegalic cells, you can see it in the centrifuged deposits of urine and saliva, okay, of the patient. So that is one thing. And you should know that in congenital infections, sometimes this virus can be excreted in the urine for up to 5 years, okay, of the baby's age. So that is another thing. Then the second kind of diagnosis you can do is you can try to isolate the organism from any of these body fluids, urine, saliva, body fluids, cervical secretions and all that. Another method you can do is try to demonstrate the antibodies, the CMV antibodies. Again, this is useful only for primary infection, not for reactivation. Now we use only ELISA, but other methods are complement fixation, indirect hemagglutination, immunofluorescence. That is for completion's sake. And antibody detection is very important for screening your donors. Okay, so this is a picture of the cytomegalovirus. So this is a cytomegalovirus infected cell. This is a owl eye appearance. You see, in pathology also you will get one owl eye appearance. I hope you remember that. Any idea when you get it? In path, there is one condition where there is this owl eye appearance. Any idea?
Hodgkin's lymphoma.
Pardon?
Hodgkin's lymphoma.
Yes, yes. That, what is that cell known as?
Reed-Sternberg cell.
Little louder, please.
Reed-Sternberg cell, ma'am.
Known as the Reed-Sternberg cell, isn't it? So don't get confused between that and this. This is cytomegalovirus infected cell. Okay. And this is immunofluorescence. You see the viral proteins which are there in the fibroblast cells. That is, you have grown the virus in the fibroblasts. And then what you do is you usually do an immunofluorescence staining. Okay. And then once the virus has multiplied, you give some time. And then when you see, you will see specks of fluorescence. That means the virus proteins are there in the sample. Okay. And regarding prevention, you should know that there's no vaccine available. So these high risk cases, isn't it? Like those who are going to get an organ transplant, you have to screen the donors. Okay. And then to prevent, suppose they are exposed to the infection, you can give CMV immunoglobulin, or you can give acyclovir for prophylaxis. But suppose a person has got a severe CMV infection, they will respond only to ganciclovir, like CMV pneumonia or something. They'll respond to ganciclovir and foscarnet. So this is in very short about your cytomegalovirus. So today's class on herpes, we discussed two viruses, isn't it? So one is the herpes simplex virus. So we saw about the details of the herpes virus, isn't it? First we saw the structure of the herpes virus. Then we saw about herpes simplex virus type 1 and 2, what are all the diseases caused, and then how we are going to diagnose it. Then we also saw about cytomegalovirus, again the diseases caused and how we are going to diagnose it. The next class, we will talk about varicella zoster virus and Epstein-Barr virus. Okay, so I hope this was useful, and in case you have any doubts, you can ask me. Okay, no, Nityashri, any doubts?
No, ma'am.
Okay, so Sudarshan and Balaji.
No, ma'am. Thank you, ma'am.
Okay, so I hope you benefited by this class. So next talk, I will share this PowerPoint also. Next talk, we will discuss about varicella zoster and the other one. Okay, Epstein-Barr virus. Just to remember, herpes viruses, all the 4 viruses are very important. You can expect 2 essays, 2 short notes. Okay, the 2 essays are herpes simplex and varicella zoster. The 2 short notes are cytomegalovirus and Epstein-Barr virus. So the lesson as a whole is very important. Okay, so take home points. You try to remember, recollect, and note it down. Okay, so in case you have any doubt, you can contact me. Do you have my? I'm sure you must be having my number, so you can contact me on that number. I've already given last time, but again I can write it down. Just 1 minute. This is my number. Okay, this is my email ID. Anybody wants the PowerPoint can mail me. Okay. Thank you. Thank you all. You can note this down. You can take a screenshot and you can mail me and I will send you the PowerPoint. Okay. Thanks. Good night.
Thank you, ma'am.
Thank you, ma'am.
Thank you.
ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am. Thank you, ma'am.